Bowel cancer, unfortunately, can often have very few symptoms. If patients do have symptoms, there's often a change in bowel habits, bleeding in the bowel, or an alteration between constipation and diarrhea. But unfortunately, bowel cancer can often be silent of any symptoms. That's why it's critical to have our surveillance program. In Australia, from the age of 50, every second year, patients have a fecal occult blood test. And the intent of this is that it detects bowel cancer before patients develop symptoms. Unfortunately, bowel cancer is far too common. In 2022 in Australia, there will be more than 15,000 patients diagnosed with bowel cancer. And at one point in time, 55,000 Australians are living with bowel cancer. And if you look at all cancers, bowel cancer constitutes 10% of all cancers in Australia. Bowel leakage or discharge can be a sign of many different conditions. Certainly cancer is one of them, whether it be anal cancer or rectal cancer. Also, bowel leakage can be a sign of hemorrhoids, rectal prolapse, where part of the rectum is protruding externally, or any other of the proctology conditions. The critical thing is that if you feel you have bowel leakage, it's important to be seen by a colorectal specialist. We are learning more and more about the causes behind bowel cancer. Interestingly, it's thought that there's a multimodal approach to bowel cancer developing. Environmental exposures, so smoking, eating high volumes of red meat, processed food, low fibre foods all increase your risk of bowel cancer. But interestingly as well, we've learnt that there's a great role of the gut biome in developing bowel cancer. The gut biome is critical to the gastrointestinal health. And we know that as the gut biome changes, that translates to different conditions. So firstly, if we look at cancer, we know that as the gut biome changes with some of the toxic types of bacteria, that increases cancer risk. We also know that there's a huge role of the gut biome in affecting inflammatory bowel disease, also infectious types of conditions of the colon. So not smoking, making sure that we're not overusing antibiotics, and generally eating well, having a highly nutritious, high fibre, well-balanced diet is critical to the gut biome. And we know that by targeting that, that'll translate to better health outcomes.